Hello and welcome back to AP Psychology. I'm Miss Lee and we're still in Unit 8. This video is going to be focusing on somatic symptom disorders. By the end of this video, you should be able to discuss the major diagnostic categories, including somatic symptom and related disorders. If you haven't done so already, go ahead and grab your notes and let's get started. So somatic symptom disorders are characterized by physical symptoms that seem to suggest a physical disorder, yet they have no physical causes, or there is evidence that suggests the symptoms are linked to psychological factors. The two big ones that we'll be discussing are conversion disorder and illness anxiety disorder, which was formerly hypochondriasis. So before we cover the two disorders that were on the previous slide, I wanted to talk to you a little bit, very briefly, about Munchausen syndrome and Munchausen syndrome by proxy and Ganser syndrome. These are several disorders that are considered to be factitious disorders. Munchausen syndrome and Munchausen syndrome by proxy. This is a mental health disorder where you falsify, exaggerate, or induce physical, emotional, or cognitive disorders. If it is Munchausen syndrome, it is imposed on the self, and if it is Munchausen syndrome by proxy, it is imposed on someone else, often the patient's child. People with factitious disorders act this way because of an inner need to be seen as ill or injured, not to achieve a concrete benefit such as getting medications or financial gain. This is different than malingering, where someone exaggerates or fakes an illness to, for example, get out of work or to get some type of insurance settlement. So malingering is for a gain, an external gain, and these factitious disorders are not. Ganser syndrome is a rare and still controversial condition whose main and most striking feature is the production of approximate answers, or what we consider to be near misses, to very simple questions that should be very easy to answer for the patient. For example, when asked how many legs a horse has, a Ganser patient will reply 5, and answers to arithmetic questions will likewise be wrong, but only slightly off the mark. So, for example, 2 plus 2 might equal 3 according to a Ganser syndrome patient. The symptom was originally described by Sigbert Gansert in 1897 in prisoners. Collectively, factitious disorders are serious mental disorders whereby someone will deceive others by appearing sick, by purposefully getting sick, or by some type of self-injury. Factitious disorders also can happen when family members or caregivers falsely present others, such as children, as being ill, injured, or impaired. Symptoms can range from mild, with a slight exaggeration of symptoms, to severe, and the person might make up symptoms or even tamper with medical tests to convince others that treatment, such as high-risk surgery, is needed. This is not the same as inventing medical problems for practical benefit, such as getting out of work or winning a lawsuit. Although people with factitious disorders know they are causing their symptoms or illnesses, they may not understand the reasons for their behaviors or recognize themselves as even having a problem. Conversion disorder is also sometimes called functional neurological symptom disorder. This is where unexplained symptoms or deficits affecting voluntary motor or sensory functions suggest a medical condition, yet there is no medical condition existing. The onset is usually after a stressful event, and common symptoms are paralysis, blindness, deafness, and difficulty walking. Many of the symptoms are anatomically impossible, like glove anesthesia and inability to feel the hand, yet has sensation in the arm. That's neurologically not possible. One of the most significant indicators of conversion disorder is known as la belle indifférence, beautiful indifference. The person has extreme anxiety in other areas of their life, but the lack of concern about what appears to be an incapacitating physical ailment. Often, such symptoms allow the individual to escape from their current frustrating situations, and sometimes leads to a secondary gain, such as attention or affection. Illness anxiety disorder is a preoccupation with the idea that one has or might get a serious disease, along with misinterpretation of bodily symptoms or functions. There are 3 major characteristics. There is physiological arousal. The person is worried, anxious, and sometimes has sleep disturbances. There is a bodily focus, close monitoring of bodily features, and a preoccupation with physical complaints. And the behaviors are designed to avoid or check for a physical illness. The person might avoid those who have a disease and may engage in repeated self-inspection or medical consultation. Explanations of these disorders can be difficult and sometimes very unclear. Episodes are nearly always triggered by a stressful event or an emotional conflict. Easterners and women of all cultures are more vulnerable with illness anxiety disorder. Although the causes are unclear, it's thought that personality, life experiences, and upbringing, as well as inherited traits, may all play a role. And that is it for somatic symptom disorders. In our next video, we'll be talking about schizophrenia and related disorders. I can't wait to see you then. Bye for now.